Hello, everyone. Is Representative Hashimoto on? Jacob, ready?
Yep, ready when you are, Senator.
Okay.
Okay.
Ready, yep.
All right. Thank you, Senator. Aloha, everybody, and thank you for joining us for this first part of the Kupuna Caucus meeting. The first 30 minutes of this meeting will be a media availability, so I do want to welcome members of the media who are on this call. And really the purpose of this first part of the meeting is to introduce the Kupuna Caucus legislative package that was introduced for this 2022 session. There are a number of bills that have been introduced that address a number of topics and issues relating to our kupuna, and we really wanted to use this opportunity for the members and our community advocates to talk about the importance of this bill, of these bills, and why we need to get it passed. I do want to recognize the co-conveners of the Kupuna Caucus. We have Senator Sharon Moriwaki, who is on the call, as well as Representative Hashimoto. So they are the co-conveners of the Kupuna Caucus, and they've been working very hard in the interim and in these first couple of days of session as these bills go through. We are going to go through each bill one by one, and we will have speakers that will be speaking on it. And then at the end, we will ask the media if there are any questions and an opportunity to engage in dialogue very shortly. We anticipate that this first section will be over at 2:30 because the Kupuna Caucus does have a full schedule and they have a bunch of presentations after, which members of the media are welcome to stay and to observe as the meeting is being streamed live. But we're going to get started. And the first bills that we have are SB 2680 and HB 1823, Our Care, Our Choice Act enhancement. These bills would expand the Our Care, Our Choice Act, which allows for medical aid in dying. And speaking on this issue is Samantha Trad, National Director of Care Advocacy for Compassion and Choices. Samantha?
Thank you so much. And thank you to the Kupuna Caucus for choosing this really important issue as one of your top priority bills. So in 2018, the Hawaii State Legislature passed the Our Care, Our Choice Act, giving terminally ill Hawaii residents who are able to self-ingest their medication, who are mentally capable of making decisions, the ability to get a prescription for medication that could peacefully end their suffering if they choose to. Over the last few years, we've realized that it's very, very difficult to access this law. Imagine if you or your loved one had terminal cancer, and after you tried everything to survive, you had to finally come to terms with the end of life. And what we're hearing, we get calls frequently from people who desperately want to end their suffering. They're in pain and they aren't able to access the law. So in 2019, the Department of Health actually recommended to the legislature to make some amendments, which this bill is based on. So there's two critical components to the bill. The first one would expand the number of medical providers who have it within their scope of practice to be able to support patients in this option. As I'm sure everyone knows, with the growing physician shortage, this is really critical. Advanced practice registered nurses with prescriptive authority actually already have this within their scope of practice. So this amendment would allow them to be one of the two providers, actually one of the three providers that a patient has to see in order to access the law. So there's still many steps a patient would have to take, but it would be easier to find a provider. And the second critical component is the mandatory minimum waiting period. Hawaii has the longest of all the states that have authorized medical aid in dying with 20 days. And we know from data from Kaiser and Hawaii Pacific Health that about 30% of patients actually die during this waiting period. And this is because patients wait until they need the medication to ask for it. Most people don't realize what a cumbersome process it is to access the law. So these smart amendments would make it much easier for terminally ill, mentally capable Hawaii residents to be able to access this compassionate end-of-life option. Thank you for your support. And if you have any questions, I'll be here.
Thank you. The next bills we have are SB 2676 and HB 1824, long-term care ombudsman program. These measures would add 5 ombudsman program specialists to the long-term care ombudsman program. And speaking on these bills is John McDermott, State Long-Term Care Ombudsman of the Executive Office on Aging. John?
Thank you. Well, first, mahalo to the Executive Office on Aging, the Department of Health, and Governor Ige for requesting 2 additional positions for the Long-Term Care Ombudsman Program in his budget. And a much bigger mahalo to the Kupuna Caucus, PABIA, Kokua Council, AARP, and many other senior advocates who are supporting our need for actually a total of 5 positions. I'm a staff of 1 with Lindy Itani as my volunteer coordinator, plus an Oahu ombudsman that we just hired yesterday. Yes, we have wonderful volunteers, but volunteers are not a substitute for staff. We need a full-time, permanent local ombudsman for Kauai, for Maui, for the Hilo side, for the Kona side of Hawaii, and 1 more for Oahu. The neighbor islands should not have to wait for me to show up and come to the rescue. In 1995, the National Institute of Medicine recommended a minimum of 1 full-time ombudsman per every 2,000 residents. We have almost 13,000 residents. If this bill passes, we will finally meet that 1995 standard. We have 1,779 facilities spread over 6 islands. For me to visit every facility quarterly, which is the federal requirement, I have to be at 30 facilities a day, every day. We started as a demonstration project in 1975. We became federal law in 1978 and state law in 1979. So the neighbor islands have actually been waiting for their own local ombudsman for 43 years. Adult Protective Services have staff, Office of the Public Guardian have staff, Hawaii Disability Rights Center have staff, Office of the Healthcare Assurance have staff, Office of the State Ombudsman have staff. My program also needs staff. COVID made it very clear that having an ombudsman on each island is the right thing to do. There were no flights to the neighbor islands during the worst part of this pandemic. Renting a car was very difficult to find and expensive. I couldn't get to these facilities to check out our kupuna. Because family and friends couldn't visit, many residents with dementia declined dramatically. An ombudsman has access to the residents 24/7. I need staff who will monitor what's happening, call bells being answered, folks being fed, bathed, dressed. Some activities, so our kupuna are not left in bed all day long, staring at the walls because there's nothing to do and the facility is short-staffed. A local ombudsman is there for evening investigations when called for, there for family councils that meet on the weekends, there for senior fairs, there for multiple timely follow-up visits if needed for a complaint investigation, there on a regular basis to establish a rapport and a trust with the residents, there to recruit local volunteers, and there to explain the program to the mayor, the county council members, the local media outlets, and local senior advocacy groups looking for guest speakers. My kupuna are the most vulnerable. Many of them are alone. Family members have moved to another island or the mainland or died. They are afraid to complain for fear of retaliation. Everything we have, we owe to them, but they seem to be forgotten, hidden in their long-term care facilities, no longer able to speak for themselves. Our neighbor island kupuna and their families have been waiting a very long time. Please don't make them wait any longer. Mahalo.
Thank you, John. We are going to go out of order because I know Senator Misalucha needs to run to a hearing and they need quorum. So we're going to jump to SB 2679 and HB 1822, driver license for seniors. These bills extend the renewal period from 2 years to 4 years for licensees who are aged 70 or older but younger than 80. And speaking on this bill is the bill's author, one of the bill's authors, Senator Bennett Misalucha. Senator?
Mahalo, Jacob, and thank you everyone for your patience and understanding. So this is regards to SB 2679 and its companion bill HB 1822. And as earlier mentioned, this bills extend the renewal period. So from its current 2 years to 4 years and requires them to present certification of physical and mental competence from a doctor upon application. So as we know, many of our kupunas are driving, and at that age, they're still physically and mentally active as they continue to, go about their daily chores. So having these licensees do their licenses every 2 years has been burdensome. We've heard a lot from our kupunas. And so for them, it feels like an endless cycle of applying, scheduling and going to appointments, especially during this pandemic. So many of them, just like how many of us get certifications from our optometrists, having certification of physical and mental competence will ensure and promote safety and the well-being of our driving seniors. So I want to thank the Kupuna Caucus for selecting this. I think we want to ensure that mobility is such a big issue for our Kupunas, and this would ensure that we're safe, healthy, and enjoying this phase of life, and it should be our priority. Thank you, Jacob.
Thank you, Senator. Up next, we have SB 2678 and HB 1825, State Health Insurance Assistance Program, also known as SHIP. These bills ask for an appropriation for the Hawaii State Health Insurance Assistance Program to expand the program to meet the needs of Hawaii's growing Medicare population. And speaking on the SHIP program is Caroline Kadiro, Director of the Executive Office in Aging. Caroline.
Thank you, Jacob. And thank you to the caucus members who voted on this measure to be part of the Kupuna Caucus package. And I'd also like to thank Representative Hashimoto and Senator Moriwaki for introducing these bills. The State Health Insurance Assistance Program, fondly known as SHIP, is a program here within the Executive Office on Aging, and we are celebrating our 30th anniversary this year of this vital program. SHIP provides free, local, unbiased one-on-one assistance and counseling to educate Medicare-eligible individuals, their families, caregivers, and soon-to-be retirees about cost-effective, informed health insurance decisions. The program is cost-effective, saving Medicare individuals hundreds of thousands of dollars through counseling and plan comparisons. We engage our kupuna with valuable information so that they can make the best decision for themselves and their budgets based on their own needs. This program is a volunteer-based program, and we have over 100 locally trained counselors who last year assisted over 4,200 kupuna and soon-to-be retirees. Volunteers provide that one-on-one counseling, presentations to employers and senior groups. They provide administrative support, training, and distribution of information, and support community outreach events statewide. First, SHIP needs to expand to meet the growing demand. In 2021, Hawaii had over 278,000 Medicare beneficiaries, and this figure is going to continue to grow as the baby boomers become eligible for Medicare at age 65. However, the number of dedicated staff has not changed since the inception of the program, which is our two full-time staff that we have on staff here at EOA. So we rely heavily on our savvy volunteers and our committed partners and stakeholders. Second, we engage partners such as the Social Security Administration with projects such as Project Grad 65, and that's to educate retirees and individuals turning 65 to enroll in Medicare to avoid lifetime late enrollment penalties. And finally, we continue to develop the workforce within SHIP by contributing and with the Intro to Medicare course, which is offered at the University of Hawaii, which allows graduate students the opportunity to develop tools for the program and also to engage with community partners to get hands-on experience in working with our kupuna and to prepare them for a career in gerontology. So again, mahalo to the Kupuna Caucus for hearing these measures. Thank you.
Thank you. Up next, we have SB 2677 and HB 1826, long-term rental assistance for seniors. These measures would establish a long-term rental assistance pilot program for individuals over 62 years old who are homeless or at imminent risk of becoming homeless. Speaking on this measure is the co-convener of the Kupuna Caucus, Senator Sharon Moriwaki.
Mahalo, Jacob, and aloha, everyone. When we talk about quality of life, we always talk about the kupuna and our efforts to have them age in place. Well, this bill allows for us to do just that. With the economy now such that the cost of housing is increasing, and the kupuna are on fixed incomes, that we have neglected to look at the vulnerable seniors who have no income to pay for the rent, increasing rent. So this program really is to prevent homelessness among our seniors, as well as to help them who are homeless to get into some housing so that they can have a shelter over their head and a place to live, to have the kind of life and quality of life that we all are striving to have for our kupuna. So this program provides for staff to help in counseling, as well as to pay for the rent, to assist seniors so that they don't have to pay more than half of their income on housing. And we have are asking for the support of the Hawaii Public Housing Authority so that units can be made available for seniors who are vulnerable and needing the kind of assistance for housing that we hope that all of our seniors will have in their later years. So this bill is for those who are 62 years or older, who are homeless or at risk of being homeless, and helping them not only with rent, but counseling so that they can have permanent housing for their latter years. And we are hoping that we can get funding for 3 years in this pilot program, that we can keep information and on how many people we helped, how it can be improved, and that this can be a permanent program going forward. Mahalo, Jacob. If there are questions, I'd be glad to answer them.
Thank you, Senator. So those, I think it's 5 bills. Yep, those 5 bills are officially a part of the Kupuna Caucus legislative package, but there are measures that aren't officially a part of the package, but will help seniors and are part of the governor's package. And one of those bills that we do want to highlight for you today is SB 3120 and HB 2152, Office of Healthcare Assurance. And this bill would increase the ceiling of the Office of Healthcare Assurance Special Fund to meet expanding program needs. And to talk about this bill is the other co-convener of the Kupuna Caucus, Representative Troy Hashimoto.
Thank you, Jacob, and thanks to all of our speakers today for highlighting all of our important bills that we are trying to push this session. And Jacob's absolutely right. I think there are many other bills out there that we are trying to support, although not our official bills, but they're equally important to supporting the needs of our Kupuna community. Obviously, one of them is the Office of Healthcare Assurance. And for those who don't know what they do, they are a very important office that regulates our care homes. And I think they have been partly having trouble modernizing. It's very important that they have these software and tools to be able to modernize their office, to streamline their permitting process, and possibly increase their staffing levels to ensure that we can appropriately regulate our current care homes to make sure that they are operating in the most safest and efficient manner, in addition to making sure that permitting times are reasonable for those who want to apply for new care homes. And I think what the problem has been in the past couple of years is that the waiting time has actually been pretty substantial. And so it deters people from officially going through the process that is laid out. So our hope is that if we can increase their ceiling of the special fund, they will be able to utilize these funds to streamline that process, to bring down the time that it'll take to get the application process completed, and it will incentivize folks to go through their allotted process. And so again, this is HB 1553. That's one of the House bills. The other House bill is HB 2152 and SB 3120. So although officially not our bill, it's a governor's package bill. In addition to Rep. Yamane has taken this on as one of his priority bills. So we want to support this effort because we believe it's a worthy cause, and it should be come to attention to everyone, because I think when we take a look at the universe of what is out there for those who are aging, this is a very important critical component, and it's the start of the pipeline of trying to get people into the care homes that they need. And without the appropriate oversight, we will have really big issues in the future. So we believe that this is a good first step, and we fully support this bill. So thank you so much, Jacob.
Thank you, Rep. And before we go to questions from the media, I know Senator Moriwaki does have a few comments that she did want to make as co-convener, and then Rep Hashimoto, when she's done, if you have some overall general comments, you can also share it at that time. But pass it now back to Senator Moriwaki.
Yes, thank you, Jacob. I did want to, Representative Hashimoto and I co-convene the Kupuna Caucus. I did want to acknowledge Representative Yamani, who's the chair of the Health and Human Services Committee in the House, and Senator Joy Sanbuen Ventura, who chairs the Human Services Committee in the Senate, because they are very instrumental in partnering with us to move these bills forward, as well as some of the other bills that are important to the Kupuna of our state. I did want to acknowledge also the other legislators who, and also organizations and individuals who are part of the Kupuna Caucus, who meet actually weekly and have been very important in terms of coming up with this package. You know, the Kupuna Caucus is the only caucus that includes the public in voting on these measures. So the 5 bills and a couple of other bills that Representative Hashimoto mentioned are all part of the package that 126 legislators, organizations and agencies, as well as individuals, have voted on. So this is very important to note, that this is representative of our community of people who care for and care about our Kupuna. So I think it says a lot about these bills going forward, and I hope that we can get everyone who's listening in to support this, testify on these measures when they come up to hearing as they move along, so that we can not only have these bills passed, but signed by the governor, so that we can indeed help the vulnerable in our community, as well as those who we want to keep active in our latter years. So mahalo everyone, and thank you for all the people who really put this package together.
Thank you, Senator. Representative Hashimoto, any general comments before we go to questions?
No, I appreciate the work of all of the members of the Kupuna Caucus, because it truly is a collaborative effort. I do want to note my co-convener in the House is Representative Greg Takayama. He wasn't able to join us today, but he has been instrumental for many years in leading the caucus, and was the one who encouraged me to take this over once he moved on to various other things in the House. I also want to make sure that we recognize my fellow colleagues who are here on the call right now. Rep. Scott Matayoshi, who is here, Rep. Jackson Sayama, and our majority leader, Rep. Della Al-Baladi. They are all very instrumental as we move these bills on the House side. So I appreciate their presence and supporting the efforts of the Kupuna Caucus.
Thank you, Rep. Now we're going to move towards the media question and answer. So if you are a member of the media, if you can please raise your virtual hand or write in the chat if you have any questions, so we can start taking questions at this time. I know we have some in the audience. Anyone have any questions, any comments? Okay, I see Leila Fujimori from the Star Advertiser. Leila.
Yeah, hi. This question is for Senator Moriwaki about the about the bill. It's really for long-term rental assistance, but is it not more a question of a lack of senior housing or affordable housing? I mean, how do you fill that need?
There are a number of other bills, Lila. Thank you for the question. There are a number of other bills going forward in terms of not only rentals, but also building more housing. Housing is our number one problem in the state. I think we all acknowledge that. And to the degree that we can build more housing to get not only for sale, but for rent, we can address the problem. What we're seeing, another concern that I have is homeless. That's the number one problem that we've been faced with. We see that there are a number of seniors who are affected by it because of their fixed income. So these bills are to help them with paying for rent, so that we can keep them in their own homes, or to get homes or shelter for them on a permanent basis. But you're right, the problem is with more housing upstream, and the more that we can work on that, and that is a priority this session, as you can see a number of other bills on housing and affordable housing, and how to pay for that. Thank you.
Thanks, Leila. Blaze?
Yeah, just a quick follow-up to that for Senator Moriwaki. Are there barriers to Kupuna being able to access, rental assistance programs that are already available, or is this kind of just to set up a fund so that, there's already money set aside for them that they could tap into?
Yeah, thank you, Blaze. There's no money set aside, and I think this is why we're putting this forward. There's money for rent assistance, but whether they get the assistance because the demand is so great, we always run out of money, and there's a long waiting list for rental assistance for, say, the supplemental rental assistance program, that this is trying to be I would call a set aside, so that it is available for seniors, and it is a 3-year program, so that we can assess the need, the demand, and whether it should be a long-term set aside, because seniors don't really know how to access these kinds of programs. So part of the program as well is to have a couple of specialists to help seniors understand what, and counsel them on how they can get permanent housing should they face the problem with paying for their rent.
Thanks, Blaze. Any other questions from members of the media? Going once, going twice. Oh, Leila, follow up.
I was just thinking that the driver license thing might get a lot of pushback. I'm not sure, but how does a physician determine whether a person, whether their patient can actually drive? I'm just wondering about that. I mean, I know physical and mental capacity or whatever, but seems sort of subjective.
Is there any legislators or advocates on the call that could answer that one?
I think Senator Misalucha introduced the bill. She's not here with us.
Leila, I can follow up with you after. Maybe we can try to get something from Senator Misalucha, as she was the introducer of the bill. So,
and probably, Leila, as the bill is going through, I mean, that's what the hearings are for. Maybe the pushback and some of the people who have problems with how we measure that will come forward, and that's how the bill can be further adjusted to address that concern.
okay, thank you. Any other questions from the media? If not, I do want to say thank you for attending this section of the meeting. For members of the meeting will continue. So if you want to stay on, please do. But this ends the formal press conference for today. Thank you.
Hello, Jacob. Hello, everyone. Okay, so are we on? Everybody, we're going to move into the legal aid, Kupuna Legal Aid Services, Legal Aid Society of Hawaii. Is Joni Dominguez on?
Yes, I'm right here. Good afternoon. Hi.
Are you and Caroline on as well?
Yes, Caroline.
Okay, Caroline Conlon. Okay, proceed. Thank you for joining us.
Thank you so much to the Kupuna Caucus for inviting us to present today. So Carolyn and I are attorneys with our Kupuna Legal Aid Services. It's a project of the Legal Aid Society of Hawaii. This is the first time we're actually presenting to the caucus as far as our Kupuna services. We're pretty new. We were created the latter part of 2019, just before the pandemic. We do have a slideshow a PowerPoint that Caroline can put up so you can follow along. It's only 14 slides, so what we're presenting today is really a high-level overview. It's not going to be a lot of detail because we know we don't have a lot of time. As far as questions, we ask that you reserve to the end of the presentation for the Q&A portion. We're happy to address any questions you have. You can put it in the chat box. You can unmute yourself and ask the question. So without further ado, first slide, second slide, please. So Legal Aid as an organization overall, we have statewide coverage. We are the oldest and only legal service provider with offices statewide. Often people think that we are state funded, but we're not. We're a private nonprofit law firm. And we depend on funding just like all the other nonprofits, largely funded by the federal government, state, of course, very grant driven. We're founded in 1950, so we do the math, right? We're 72 years old, so we're Kupuna ourselves. As far as an organization, we provide free legal services to those who qualify. And we have 10 offices statewide. On Oahu, we have 4 offices. One, what I call a specialty office, which is our Hawaii Immigrant Justice Center, and then an office where I am actually sitting in the office right now in Honolulu, which is our main location, an office in Kaneohe, an office on the leeward side, 2 offices on the Big Island, and then 1 office each on the other islands. We have 6 major areas of legal practice as an organization. They're listed here, not in any order of priority or importance or need. I think I just simply listed it alphabetically. So starting with consumer protection, and very quickly, debtors' rights. So we primarily assist those who are defendants, right, in a debt collection lawsuit. We assist homeowners who are in danger of being foreclosed on or even imminently falling behind on their loans. That would also include seniors who have reverse mortgages. We also have, and it's not listed here, but I want to be sure that you know that we have 2 advocates who do reverse mortgage counseling. That's a pretty new program that we recently started. Copyright trolling, actually wanted to take this out. It takes a lot for me to explain it. Basically, there's an attorney in Kona who had been, at least in one time, bringing lawsuits against people who he alleged were illegally downloading movies. So just a note, be careful when you download a movie and it's free, you know, because there is this attorney out there trolling around, making legal demands on people and earning money that way to make a living. And then really last but not least, student loans, private loans, federal loans. We can provide services around that. Family law is really major area of practice. Of course, divorces, child custody issues. When I say spouse and child abuse, a lot of the types of assistance we provide is around when there is domestic violence involved. We prioritize that kind of case, even if it's contested. But otherwise, a lot of what we do is, especially if it's court action, maybe around uncontested types of cases, unless, like I just mentioned, there's domestic violence involved. TROs are protective orders, and then guardianships and adoptions. And before I even proceed, I just want to make it clear that the types of services you can get, even though we practice all these these areas of law, it's really going to depend on what island, what office, what grant funding we have, and even down to the staffing availability and the staffing expertise. We have what is called, when someone calls for services, we have a list. It's called case referral criteria, and it's constantly evolving, constantly changing because of the factors that I just named. But what I really want you to take away from this is actually what we do, the practice areas. And we always encourage people to call us. You know, don't make the determination yourself whether or not we're going to help, just call us. And at the end of the presentation, I will tell you how people can access our services. So next is our housing practice, landlord-tenant law. With the lifting of the eviction moratoriums, and now what's called Act 57, which is addressing, the increase in the number of evictions due to the pandemic. We are really involved in court right now on the tenant side. So we typically don't represent landlords. We're tenant emphasis here. But again, right, maybe if it's a senior, they could possibly call us, but I'll get on a tangent on that. So just know, landlord tenant evictions. We do tend to prioritize those tenants that are in danger of losing their subsidized housing or rental assistance. And then really last but not least in the housing front is our fair housing practice. It's pretty robust, and that is around people who may have been discriminated against in a housing context based on either state or federal protected classes. So I think this is the fourth area of practice, immigration. As I mentioned very early, we do have a specialty office for this, and they handle all of our immigration cases. So around human trafficking, family reunification, citizen applications, and from my understanding, they assist people a lot with replacement documents. And then public benefits, this is around, of course, like Social Security, state health insurance, Medicaid, Medicare, DHS benefits. And when I think about what is it that we help with, it could be the spectrum from applying, helping people who have been terminated from benefits or denied benefits, right? So appeals, and then potentially people who have been, if there's an overpayment of benefits. And then, so this is our sixth area of practice, which is what Carolyn and I do. And I didn't mention the slide, the first page of the slide gives credit to Rachel Raynon. She's our paralegal. So the three of us actually make up our Kupuna Legal Aid Services. We are housed in our Honolulu office, but I also want to be sure to mention that the Kupuna services, the senior services, are available statewide because we have senior paralegals on all of the islands. And we are funded primarily by Title III, which is part of the Older Americans Act, administered through the local county offices. So services for our seniors, in 2021, we assisted over 2,000 cases, and this is statewide. It's not just Carolyn, me, and Rachel. And who do we help? We help people ages 60 years and older who have mental capacity to understand and make decisions. But if the senior lacks capacity, if there's a legal document such as a guardianship or a power of attorney that gives someone else agency to assist, of course we help that too. There really is no income or asset limit. What we do, because of the limit on funding and resources, we do prioritize vulnerable seniors. So what does that mean? Vulnerability, largely it's around like if you're lower income, if you're mobility impaired, it can be, right, wheelchair bound, you could be housebound. We do make home visits. The other thing we get, a fair amount of cases, seniors who are limited in English proficiency, we do provide interpretation and services. Always, right? If it's going to assist us in giving them meaningful representation, we have that ability to do so. And with that, I believe Caroline's going to present on the specific types of services that we offer to our seniors only.
Thanks, Joni. As Joni mentioned and kind of went over, we have our general areas of practice for the organization as a whole. But our unit, we have specific things that we do just for seniors. And we kind of look at a lot of times as a package. There's several different types of documents that we can help seniors prepare just to help manage and, prepare for when they're not able to do things themselves or for what's going to happen after they're gone. So the main one, I'm sure you're all familiar with, advanced healthcare directives that allow them, our seniors and really anybody, obviously, to give instructions about their future medical care and the treatment they want, and also to name their agent who's going to assist in making those decisions for them when they're not able. We also will do financial powers of attorney, where they're able to give someone legal authority to manage some or all of their financial affairs. They can specify exactly what authority they want to give, when they want that to be effective. And it's a really useful tool. And actually, what we try and emphasize is how much it helps when things go wrong. And, when seniors aren't able to, manage things themselves, if they've already laid out those instructions, it really helps not only them, but their family in smoothing the process and making sure their wishes are followed. So that's really important for everybody to have those documents. And the other one we do along with that, mainly, we usually do all three together, is simple wills. So again, document that after they pass, that states their wishes and what they want to happen to their property. And another one we will sometimes do, I know Joni said we prioritize vulnerable seniors, which we do, but we have a lot of seniors in Hawaii who we kind of refer to as land rich and cash poor. Their only asset is their home. And a lot of times people think that they, by, adding their kids onto property now, or, giving the property to their kids, it'll make things easier, but it can actually cause more problems. And so one of the things, we assist with, if someone is a property owner, is transfer on death deeds, which are, I guess, not that new anymore, but they're really a great tool for ensuring that your property goes to who you want it to after you pass. And it also, again, simplifies the process and makes it easier for your friends and your family to carry out your wishes after you're gone. And the great thing about it, though, that we always emphasize to our seniors especially, is that they're not giving anything up right now. So they still maintain total control of their property. They own it. They can do whatever they want with it. If they want or need to do a reverse mortgage, they can. If they need to sell it because they're going to move into, a smaller, more affordable place, or, senior housing, they can do that. They still have control, but it also makes it so that after they're gone, they're able to ensure their wishes are followed. So those are the main documents that we do as kind of our advanced planning practice for seniors. We also sometimes are able to assist seniors with the informal probate process. We have, the main ones we assist with are generally spouses. When one spouse has passed and for some reason or another, that spouse was the only one on title to their home. And the surviving spouse is really having trouble getting things done and taking care of things. So in limited situations, we are able to assist with the probate process to get that spouse appointed as representative of the estate, so they're able to settle the affairs and make sure that, for themselves moving forward, things are going to go more smoothly. So even if we're not able to do the probate for them, we are at least able in a lot of these situations to give advice. That's one thing that we haven't really mentioned yet, but there are several levels of our service that we provide. It can be just basic counsel and advice. It can be more extensive services, such as actually preparing all of their documents for them. And then it can go as far as representing them in court if we need to. So, it's going to depend on the specific situation, but there's, as Joni said, first and foremost, people just need to call and ask, and, we can figure out what we can do for seniors and anyone who qualifies for our services and what level of service we might be able to provide. The last kind of focus of our unit is on guardianship. So a lot of times we are able to help seniors with guardianships of minors, generally grandkids, when something has happened to the parent and they need to have that legal document in place. We also do a lot of assistance with guardianship of incapacitated persons, siblings, parents, when someone hasn't prepared those advanced planning documents ahead of time. It may be necessary to do that, go through the court process and get a guardianship. And so we are able to assist with that as well. And I think I'm going to turn it back over to Joni to finish out for us. Oh, Joni, you're muted.
How does the senior access services? We have what we call a senior legal hotline, and they can call that number at 808-536-0011, leave a message, and then they will get a call back. The callback is pretty much, you know, within the first couple of days or so, but our message will stay, I think, a week for the callback. So they call, they leave a message, they leave a number, brief description of their legal issue, and then we call back. If a senior has an emergency situation, we ask that they call our general intake hotline. The general intake is also for everyone else who's not a senior that can call to access our services, and that's on the next slide. So our general legal intake, 808-536-4302. Since the pandemic, we've actually closed access to walk-ins to our office. They used to be able to walk in and apply for services. We do meet with clients by appointment only in our office, but otherwise you can't just walk in anymore until we reopen it. So phone intake is Monday through Friday in the morning from 9 to 11:30. And then in the afternoon, they open up the phone banks again from 1 to 3:30. And if you call the general intake, you will get a live person. And then another channel of access is our online intake, legalaidhawaii.org. And it's pretty simple, straightforward process to fill out a pretty brief application, and then they will get a phone call from an intake worker. So those are the various channels that they can reach us, but seniors have a little special channel through our legal hotline. So we are open to questions. So
let's see, do I see any hands? Just put your hands up or in chat. Anyone with questions for either Joni or Caroline? Oh, Rick Tabor. Aloha.
Aloha. Thank you for the presentation. Very helpful to hear all of this. It's a very useful service. I'm sure you get a lot of calls, right? How do folks actually pay for this? Did you mention that, or what is the coverage for this?
So our services are free, actually. There's no
wow.
charge, but I give one caveat around there, because if there are court filing fees involved, like guardianships, there are filing fees around that. And so the client will need to pay for that unless we think that they may qualify for a court waiver. And there are waivers around the filing fees, they will certainly ask the court to waive them. But otherwise, and another example would be our transfer and death deeds. There are county recording fees that come with that, but they're, as compared to if someone went to a private attorney for the service, it's really truly the largest the fee will ever get will be maybe around $100, but typically it's around $40 or $45. So it's very minimal as far as that is concerned, but it's not anything we don't charge for our time or expertise.
And that's regardless of a person's income or
regardless.
assets?
Yep.
Wow.
And
Wow.
Especially our senior services, we do prioritize vulnerable, but we do get clients who have, some income, a little bit of assets. And so we always encourage people to call, because we look at the application in totality, right? Based on the situation. So, yeah.
And you're well situated around the island. So how many staff do you actually have on board to handle all of this?
So for our senior services, it's just the three of us in our Honolulu office. And then statewide, it's really one senior paralegal. So I think our Big Island, of course, Honolulu, because of our, our population here in the Big Island, we get a lot of cases, but we do handle them. As far as legal aid as an organization, like in Honolulu, we have, I think, over 50 attorneys, but practicing in all the various areas that we practice in.
So they just do pro bono kind of work, volunteer, that kind of thing?
We also do take pro bono volunteers, but yes, statewide it's free services.
All right.
Wow,
I want to add on to that though. For those who are not seniors, they do need to qualify. So we have income and asset limits for non-seniors. So they have to be qualified for our services. We do have some grants that don't have, that maybe don't have income limits. Like I believe our foreclosure grant didn't have an income limit. But yeah, for regular services for non-seniors, they do have to be income and asset eligible. And then for seniors, again, we don't have income or asset limits. However, as Joni mentioned, we do prioritize those who are more vulnerable than others.
And then seniors, you consider 62, 65. What's your senior's age? 60? 60.
Yeah.
Okay, thank you.
One thing I didn't mention was Caroline and I, so I have 12 years with legal aid. Caroline, 6 years this year. Caroline used to do intake and be a supervisor in our intake. And I actually used to do consumer, which included debt collection, defense, and foreclosures. And then Caroline came from the probate court, right? Probate court administrator. Yeah.
good. Wow, good experts there to help the seniors. That's nice to know. Any other questions? Okay, then I think that's wonderful that you folks have that service and it's free. And again, that it's very simple to get the service by just calling the hotline number. And if they say what I'm 60 years or older, then they get preference.
Yeah, that's interesting. Often we get calls from family members, right? I'm calling for my mom. I'm calling for my dad, who's a senior. And so if any one of you do refer someone to our hotline for our services, we will call that person back, but we always have to talk to, at least initially, the senior that needs the service to get consent because we're a law firm. But yeah, otherwise, even if they don't say I'm 60 or over, they get the call back. So it depends what happens after that, where they go, so. And I just also wanted to say that if any one of you just didn't have a question right now, but it pops up later, call our hotline. We'll call you back. Okay.
Wonderful. Thank you so much, Joni and Caroline. We appreciate your service. And thank you for helping all of us.
Thank you.
Okay. Mahalo for presenting. We're going to move on then to the generational economy. Dr. Andrew Mason from the East West Center. He's a senior fellow, emeritus professor with the Department of Economics, Hawaii's generational economy. Dr. Mason.
Thank you very much. I'm pleased to be here. So let me share my screen. I think everybody here knows the basics of what I'm going to say. Hawaii's population is aging very rapidly. It's going to be very expensive. And there will be a lot of challenges in meeting the needs of seniors over the coming years. We already see that in the discussion today about the many needs of seniors and the costs and the difficulty of mobilizing resources for them. And so my message then is already known to everyone. So what's new? Well, in a sense, everything I'm going to present is new because it uses methods and tools that have not been available in Hawaii or any other state and have only recently been available for countries around the world. So so this is part of a global project that was developed at the East West Center and the University of California at Berkeley. We started this about 15 years ago, and it has now grown to include research teams in more than 70 countries with funding from many organizations and a great deal of support from UN agencies. If you want to know more about it, you can go online and find out about our work. What about Hawaii? Well, this work it's a joint effort by DBED and the East-West Center. And you can find our study in the data portal that we developed online, like everything is these days. So let me just go over a couple of key conclusions. So one of the things is that the cost of aging is rising very sharply in Hawaii. So what do I mean by that? The cost to whom? Well, I'm talking about the cost to all of us. So the way we measure that is looking at what seniors are consuming in any year as compared with how much they're producing from their labor. So in 2010, seniors were consuming about $10 billion and their labor income was about $2 billion. So the gap that has to be somehow made up was about $7 to $8 billion in 2010. Now the gap has grown since then, and it's expected to, in 2035, reach about $12 billion. So that's an increase of almost $5 billion, which I consider a great black hole that Hawaii is going to be facing in the coming years. So that's where the challenge comes. And now, what kind of ways can we deal with this? Well, one thing that our study looks at is to quantify how people at different ages are satisfying this gap, how they're doing it somehow now. So what are they doing? Well, there are four things that I want to emphasize here. The first, of course, is federal programs. So seniors receive a lot in public transfers beyond what they pay in taxes. So seniors both pay and receive from the federal government. And these figures show the percentage of that gap that I showed you that's funded in two broad age groups, 60 to 74 and 75 plus. There's a big difference between these two age groups and how they're funding their old age needs. So if we look at the 75 plus, about half of their needs are being funded through federal programs, Social Security and Medicare for the most part. What about state and local government? Well, seniors are paying more in taxes than they're actually receiving in benefits at the state and local level. So their big issue then is, will the state and local government begin to step up more when it comes to Kupuna? What about families? We often hear how important they are in supporting the seniors. And I suppose this is true when we talk about time. But when we talk about money, it's not so important. So seniors 60 to 74 are actually providing more in support to their adult children and their grandchildren than they are receiving. That's why we see a negative value there. And seniors 75 and older are receiving a fairly modest amount. So the remainder of the needs are met by assets. Over half of all needs of seniors are met relying on assets. What do I mean by that? Well, that's pensions and saving and businesses that seniors own, and owner-occupied housing is also very important. So this is a basic picture of where the seniors are today and where we're going to have to look to find more resources. I do want to emphasize here that this results here for all seniors combined in these age groups. They would be very different for low-income seniors, and this is something that I think would be very important to explore in our future work. So what are some strategies for funding old age needs? Well, I've kind of grouped the things that I think are potentially important into four broad areas, and I color code them to indicate how helpful those are likely to be. So one is to plan on more generous Social Security and Medicare benefits. And well, I'd label that red because I don't think that's going to be very helpful to us in the future. All states are facing the same kind of aging issues we are, and it's going to be very difficult to provide more generous benefits from these programs. What about reducing healthcare costs while maintaining quality? Well, I think this is very important, but it's also very difficult. We want to try to reduce healthcare costs, but we certainly don't want to reduce quality. And in many areas, we would like to improve on quality. The last two, I think, are promising. One is to retire later and increase productivity at older ages. So this is something that I think should be a big focus of everyone, not just the legislature, but also seniors themselves. So people like me should continue to work. We should continue to try to be productive, whether as part of a job or part as volunteers in civil society. And then the final one I want to emphasize is to encourage accumulation of assets by saving more. So we have a lot of programs that are very helpful to some who are facing old age in the future, but there are also a lot of working age adults who do not have access to the kinds of programs that I think would be very beneficial for them. And so I would emphasize that as one of the ways that people could really try to deal with these issues. So with that, let me stop.
Okay, thank you, Dr. Mason. Do we have any questions, members? Dr. Mason, anyone with questions? If not, I do. Did your study look at what some of these options might be for the green areas, retiring later, encouraging accumulation of asset savings? Did you were you able to gather what people have done to address those two areas that you have in the green?
Well, we haven't done very much in that. Really, I think our big contribution at this point is to identify what people are doing today and how they're meeting their current needs. And this is not only for seniors, but this is for people at all ages. So our study also applies to children and working age adults and what their situation is. I think this would be a great follow-on study to try to fill that out more.
So from your study, do you have any other recommendations that you might provide for us? I think the two areas that you mentioned in the green are doable, and at least we can plan forward on those. But do you have any other recommendations that you might offer?
Well, I'm glad you asked. I don't know if I'm still sharing the screen, but let me do that. So what can government do? Well, invest more in children. So seniors are going to be supported by children who become workers. And if our children are not highly productive, we're really in trouble. Second, empower women. A lot of women are not earning as much as they should be. They don't have many of the opportunities that people like me have had in our lives. And most seniors are women. And so this is a critical area. I think I already mentioned improved saving programs for the self-employed and small business workers. Reform public pension programs. I am myself a beneficiary of public pension programs, and I know how generous they are. And it seems to me that some of them are probably overly generous for high income people. We need to have pension programs that really target people who are more in need than we are right now. And then a final area would be to strengthen healthcare systems, particularly for low and middle income individuals. Too much of our healthcare resources go to very, very expensive and not so effective programs. We provide Cadillac benefits that really don't encourage the best use of our resources. So some of these are challenging things for Hawaii to tackle, but I think there are just some suggestions about the kinds of things that we could be doing. I also, let me just say, I want to point out that this isn't all government, You guys can do certain things through passing bills and the administration by operating new laws and so forth. But it's really important for young people and prime age adults and for seniors to take responsibility and understand what the challenges are and what they need to do to prepare. And so I've listed a few things that I think are very important. And well, this is a matter of education. That's my business. So we need to educate people to understand how serious these challenges are going to be and how important it is that they practice good health, that they pursue lifelong learning, that they are realistic in their financial goals and do the right things that they should do to provide economic security for themselves, and that they remain actively engaged in whatever way that they can throughout their lives. So those are my kind of go-to points.
Well, thank you. Thank you, Dr. Mason. Any other questions from anyone? I know that we do have the Hawaii Saves program that Kathy Wyatt brings up. So we are looking at a savings program as well. We'll see how it fares in the legislature this year.
Yes, Senator, this is Audrey.
Yes. Oh, Audrey, yes, please.
Yeah, hi. So thank you, Dr. Mason. We've read your report. I'm Audrey Suganakagawa from AARP, and Senator, you had mentioned that there is two bills, Senate Bill 3289 and House Bill 2046, which is looking to establish a state facilitated retirement savings program that will help our employer or employees who work for small businesses or for themselves really have an easy way to access and start saving, so they would avoid the kind of problems that Dr. Mason has pointed out. So thank you so much for this report, because this is very important for the task force who had studied this issue and are really concerned about the future of our kupuna, who's going to be retiring and not having enough to save and not enough to live on. They can't rely on Social Security. Dr. Mason, I have a question for you, though. In terms of the cost to the state, I mean, we saw the $4 billion gap. So can you kind of explain that in further details of what that really means to our lawmakers? When we talk about the costs to the state, are we talking about the public assistance program that we're going to have to fund to help people pay for food, for rent, for Medicaid? Can you just elaborate a little bit more about what the implication is for the state if they do nothing, we do nothing?
Well, sure. So this is not a gap for the state government. Okay, I think everybody understands that there's just no way the state government can pay an additional $4 billion to help seniors. And this is every year we're talking about, not a one-time event. So it's the amount of resources that are going to be needed if we're going to maintain current standards of living. And this is arising purely because we have so many more seniors than we've had in the past. And so there are a lot of folks out there that are going to be trying to come up with ways that they can support themselves. Now the programs for seniors provided by the state, the direct programs for seniors are important, but they're not terribly, there's not a lot of resources involved, according to our numbers. And so I think for the legislature, the thing to be thinking about is that there are going to be a lot more needs in the future than have been in the past. And so I think people, especially people who are don't have housing, or who have food insecurity, or who have low income, are going to really be looking more and more to the legislature for ways to get the support that they need. And so these are the things I'm talking about are not senior programs strictly. They're programs that everybody would be more income, but it's just that they're going to be particularly acute for seniors. And so that's where we're going to be looking for the need. So the other thing I think is how important it is that we prepare, that this is going to come. There is no question about that. We know that we're going to experience severe population aging over the next 15 years. And it's going to be very disruptive. I like to say, that aging is in fact a wonderful outcome. We all prefer the alternative. I mean, the fact that there have been such tremendous gains in life expectancy in Hawaii, and particularly in Hawaii, is something that's very welcome, and we're very fortunate about that. But it brings challenges as well that we need to deal with.
Okay, thank you. Thank you, Dr. Mason. Any other questions for Dr. Mason? Okay, seeing none, thank you so much, Dr. Mason. We appreciate your study, and we look forward to even more study on what we can do for options for the future. Your next study.
Okay.
Okay.
My
Aloha.
pleasure.
Thank you. Okay, members, any announcements? Anyone? Okay. So we will hear from you if you have other presenters for the next time we meet. We will keep in touch on where our bills are in our package, and we'll see you next month. Any other questions, concerns, issues? Okay, aloha. It is now 3:15, so we will be wishing you all a happy new year, and have a great